Hello, my name is Terry Corley and I'm a member of the Infection Control team here at Wrightington, Wigan and Lee NHS Foundation Trust. The following podcast is going to look at the basic information with regard to infection prevention and control. With regard to clinical staff, there will be a far more in-depth time with the team tomorrow on your induction day 2. It is well known and acknowledged that people who actually are admitted into hospital can have a higher than normal risk of transmission of infection. However, please be aware that this is extremely low. When a patient does acquire an infection, it can be extremely distressing for themselves, their families, and of course the staff who are caring for them as individuals. There is also the financial cost to the trust that we have to take into account. This can be anything from lost bed days to the trust, to extra dressings, to extra staffing, and of course the reputation of our trust WWL. For example, an extra 3 to 10 days hospital stay for a patient with an infection can cost anything between £4,000 to £10,000. And for something as serious as Clostridium difficile, this could actually increase financially to a greater financial burden within the trust. So with regard to infection prevention and control, it is our responsibility, no matter who we are within the trust, to try and prevent the transmission of infection wherever possible. We all know that bacteria can live harmlessly within our skin and on our bodies, and this is completely normal. It's when these bacteria are somewhere that they are not normally found that the increased risk of transmission of infection can occur. What we do within infection prevention and control is try and prevent these bacteria from being where they should not be found, and therefore preventing the distress that this may cause our patients on our premises with our staff. The aim of infection prevention and control, therefore, is to reduce the transmission of infection to an absolute minimum. The infection control team therefore liaises with all staff throughout the trust, both paid and unpaid, both voluntary and clinical and non-clinical staff. And it is our job to look at auditing, inspection, investigation and promoting the well-being of both our patients and our staff for all different types and styles of transmittable infections. The majority of our work is within the clinical environment, but we do look and care for people throughout the trust in non-clinical areas. And it is through education and advising that we can hopefully reduce not only the patient's transmission of infection, but also that within the non-clinical areas and yourselves as staff. By doing this, it shows that it's not just ourselves within our team, but it's everybody's responsibility to help prevent the spread of infection within this hospital trust. Maintaining good health is vital to the well-being not only of our patients but ourselves as staff. And I'd like to just take you through a few aspects that are quite important within the non-clinical environment. There are many ways where we can actually transmit infection outside of our clinical environment, such common things as the common cold and diarrhea and vomiting. These are particularly important when you're working in close-knit offices within the trust, or if you're actually moving from area to area and working alongside multiple groups of people. By following very easy infection control practices, such things as coughs, colds, diarrhea and vomiting can actually be reduced while you're working within WWL. For example, bringing food into work should only be for the food that you require on that particular day. We don't expect that people bring enough food to last them a week or two and actually keep it stored within your warm offices. If you are bringing food that requires a fridge, we do require that you actually look at your fridge on a daily basis, making sure it's maintained clean. We also ask that you look at the temperature of the fridge, and legally this should be 8 degrees or lower. And we also ask that if you're actually bringing food in, that all food is labelled and dated. This means that should anything actually go off in the fridge, people can actually be informed if they've left things in there too long, or certainly we can actually discard food should you be on annual leave or unfortunately be off sick. With regard to heating food, we actually need to heat all our food through so that it is piping hot. So if you do use a microwave within your working area, we actually require that you just check this prior to consumption of food. These can be really common sense and basic rules, but if we follow them at home, we should be following them at work as well. For those of us who have the luxury of a kettle within our working environment, usually in the corner in an office, we do ask that any milk that you use is actually immediately returned to the fridge. This is because over a period of an hour or so, the temperature within the milk can actually increase and cause some gastric problems for yourselves later in the day. What we don't want to do is see milk stood by the fridge or outside of the fridge for long periods of time. We certainly don't want to walk into offices and see the milk stored on a windowsill. Hand hygiene is a very important task and should be maintained before and after each of our meals. We do this at home, and we should also do this on trust site. Coughs and colds spread diseases, so if you do suffer with a cough or cold, we expect you to catch it, wipe it and bin it. And please, please, please remember hand hygiene. Clean your hands often, and please remember the common equipment that's used within our environment, especially in offices such as telephones and keyboards. It is your responsibility to maintain these in good working order and cleanliness. So if you are suffering at any time with a cough or a cold, please think of the next person that's actually going to be using that piece of equipment. With regard to the flu season, which is commonly between October to April or May and on a yearly basis, the Trust offers a free flu jab to all members of staff who work within our Trust. I can only advise that you take this opportunity through occupational health annually to have a flu jab. It doesn't only assist you or help you, but it also helps your family, and for those of you who are looking after patients, it will greatly help the patients. For people who are volunteers within the audience, you are also able to obtain a flu jab through WWL. Obviously, for those of you who get a free one through your GP, this should be done as usual. For those who don't, there is a occupational health agreement that you can actually contact them and get your flu jab through the Trust, therefore again assisting yourself, your families and our patients. Also around the winter period, we have something called the winter vomiting and diarrhea bug, also known as the norovirus. This can actually happen quite quickly to us as healthy individuals. Quite often, 1 minute we're really healthy, and next minute we're feeling very ill with our vomiting and diarrhea. Should this happen to you, we ask that you please stay away from the hospital site until you are 48 hours free of symptoms. This will greatly assist the transmission or the reduction of transmission of norovirus on hospital site. A norovirus on one of our hospital wards can actually have devastating effects not only on our patients but on our staff looking after those patients and on the movement and financial costs to the Trust. To understand what a non-clinical area is, I need to emphasise what is classed as a clinical area. When we're actually going onto a ward, the doors of the ward onwards are classed as a clinical area. In an outpatients department, the doors of the outpatient onwards are a clinical area. If you're actually in an office on a ward, then that is classed as a clinical area. The pharmacy is a clinical area. Therefore, a non-clinical area would be the main corridor leading to a ward or outpatients department. It will be the hospital cafes, the hospital restaurant, or any offices within Buckingham Row or the Elms. Equipment found in a clinical area such as kettles, fridges, microwaves, computers and telephones are the responsibility of the staff working in that area to maintain the cleanliness of these pieces of equipment. On entering a clinical area, we ask that you clean your hands with either soap and water or alcohol gel as you enter the area and again as you exit the area. If you are entering an area to meet a patient or relative, then we also ask that you clean your hands again with either soap and water or alcohol gel prior to and after touching the patient and/or their environment. Should you enter a clinical environment, the ward manager or the deputy ward manager will be more than happy to assist you with any information around infection control with any individual patient or their relative. Non-clinical staff within the trust will probably never ever come across a sharps to experience a sharps injury. However, some non-clinical staff, as we know, do enter the clinical environment. So as part of the occupational health part of this presentation, I need to advise you on what to do should you experience a sharps injury. The first thing you would do would be to wash it under cold running water, squeeze the actual area and allow it to bleed, and then you're going to report it to the ward manager or departmental manager and your line manager. You will then also be asked to contact occupational health with regard to the risk associated with the sharps injury, and then you will be asked to complete a DATEX. This will all be done reasonably quickly following a sharps injury. The Health and Social Care Act of 2008 says that we as infection prevention and control nurses should undertake hand hygiene with you on an annual basis. Today, I'm going to demonstrate hand hygiene on this podcast. For clinical staff, we'll be going more in depth on this on day 2. And then, for future years, this will be undertaken through your annual mandatory training. Microorganisms live on our skin in quite an abundance, and some are harmful and some are not. A simple technique of hand hygiene can remove these microorganisms quite effectively from our hands. Therefore, hand hygiene will assist in removing the microorganisms, therefore effectively helping us to reduce the risk of transmission of infection. The next part of this podcast is going to concentrate on hand hygiene. There are 2 main factors to hand hygiene that have happened in the last decade. The first is something called bare below the elbows, and clinical staff will fully understand that in a clinical environment we roll our sleeves up, remove our wristwatches, rings with stones in, bracelets and bands around the wrist, and we work alongside our patients literally bare below the elbows. However, as non-clinical staff, we also need to be aware that should we enter a clinical environment, we would expect, should you be talking to a patient or a relative and having that physical contact, to also go bare below the elbows. The second major thing that has happened within infection prevention and control and hand hygiene is the World Health Organization initiative, the 5 moments of hand hygiene. So the 5 moments of hand hygiene are 1, before touching a patient, 2, before any aseptic or clean procedure, 3, after we deal with bodily fluids, 4, after touching a patient, and 5, after we've actually touched the patient's environment but we haven't necessarily touched the patient. With regard to clinical staff, we will actually utilise all of these on our working day as regular and routine. However, for non-clinical staff, you may never ever enter a clinical environment and therefore never come across the need to follow the 5 moments of hand hygiene. But for those of you who do, as part of your role, enter a clinical environment occasionally, we would expect that you would clean your hands before and after patient contact, and definitely after speaking with a patient or the relative if you've touched their environment, immediate environment, but not necessarily touched the patient. So hand hygiene should only take us approximately 15 to 20 seconds, and this can be undertaken with either soap and water or alcohol gel. The technique will be the same. However, with soap and water, it is quite imperative that you wet your hands first before applying soap. Within this trust and Europe in general, the allergens within soap have been removed, so therefore they do not contain any scent or any moisturiser. So along with hand hygiene, it is quite imperative that we actually increase the amount of times we moisturise our hands during our working day and also socially outside of work. The technique is quite simple. Wet your hands with warm water before applying soap. Rub your palms of your hands together, interlacing your fingers, then onto the back of your hands, again interlacing your fingers. Once this has been done, go to the palms of your hands onto each hand and then interlacing your fingers. Remember to rotate around your hands and then take in your wrists. Once you've done this, please rinse your hands and then remember to pat dry with a paper towel. Try and remember to dab the paper towel rather than rub it. For those staff who would like to view a podcast on the 5 moments of hand hygiene, this can be found on the intranet under Infection Control in the left-hand column. For clinical staff amongst you, this will be shown as a presentation on day 2 of your induction programme. And finally, should you wish to discuss any aspect of infection prevention and control, remember our extension is 2035. Together, we can all make a difference. Thank you.